King's College of London Global Pediatric Surgery study, which look at the pediatric congenital anomalies between high and low and middle income countries. Also, I was the regional lead of the North African countries at this time. And it was also another success. This paper was published in The Lancet, and it showed that there are wide disparities between high income countries and low and middle income countries. There are more mortality and disability in low and middle income countries. So I stopped and I asked myself, if we worked in global general surgery and in pediatric surgery, my area of expertise in neurology and neurosurgical disease, so why we don't apply model in neurosurgery? And this was the rationale for starting the Global Neurosurgery Research Collaborative. We started by formulating a group of neurosurgeons, expert neurosurgeons who have good connections. I started with my supervisors, Dr. Ahmed Higazi and Dr. Ahmed Raslan from Oregon Health and Science University. We started to formulate a group of experts in neurosurgery to act as the steering committee. We identified the priority areas. What are the priority areas at the moment in the neurosurgical care that should be addressed on the global scale and need further improvement in low and middle income countries? This is an excellent paper done by my supervisor, Dr. Kibark, in the BJSSC, where I'm currently a fellow. And in this paper, they found that it was a modeling study to find how many neurosurgeons are needed in low and middle income countries and what kind of neurosurgical care, neurosurgical diseases exist globally and their distribution in different WHO regions. And they found that the major neurosurgical condition is traumatic brain injury, followed by stroke, epilepsy, and brain cancer surgery, and on the level of children, hydrocephalus and spina bifida. So we took this paper and these results as our priority areas, and we started immediately designing the protocol of the first study, which is the Global Neurosurgery 1 study, about traumatic brain injury in low and middle and high income countries. This is the detailed results of the paper, the modeling paper. They found that TBI accounts for 45% cerebrovascular accident, hydrocephalus, brain tumors, vascular anomalies, and neural tube defects. These are the major conditions that require neurosurgical care around the world. So these are our priority areas. We drafted the protocol of the first study, the Global Neurosurgery 1 study, in August 2018, and we started the study announcement on Twitter and on social media. And I was very surprised that we found another group working on similar work on traumatic brain injury management, which is a Cambridge group by Professor Peter Hutchinson and Angelus. At this time, they have already funding to conduct a study about the neurosurgical management of traumatic brain injury. So we stopped our study for some time until the other group finished their study. It's called the GNOS study. This is their study called GNOS, Global Neuro Trauma Outcomes Study. And this is our study, GNS 1 study. In this slide, I'm just demonstrating the differences. The GNOS study, which has been recently published in Lancet, is NIHR funded. Our study is not funded, but it's internally sponsored by Oregon Health and Science University in the United States. The host institution of the GNOS study is Cambridge, here OHSU. Main investigators, Professor Peter Hutchinson and the Angelus, here Professor Raslan and myself. The scope of the GNOS is to look at the neurosurgical management of TBI. So they don't look at those cases who didn't receive surgery or didn't receive neurosurgical intervention or any conservative management. They only look at cases where an operation was done. But in our study, we look at neurosurgical and non-surgical treatments. They only look at TBI requiring surgery, but for our study, we look at mild, moderate, and severe TBI. The follow-up is 15 days. We aim for longer term follow-up up to 90 days. The study was published, it's not 2 days ago, it's 2 months ago, sorry. It was published 2 months ago in the Lancet, and our study is ongoing. Last patient is in March, and the end of follow-up will be in June next month. Currently, we have more than 2,400 patients registered on the database from 77 countries around the world. The GNOS study has 1,600 patients, and it was published in Lancet. Their authorship authorship model is based on authors list and a group author for those who collected the data. We have a different equitable collaborative authorship model. We don't put authors in the paper. The paper is published using a single name as the group name. Global Neurosurgery Research Collaborative will be the only author of the paper, and all those who participated in the study, including data validation committee, data collection steering committee, protocol writing, manuscript writing, and analysis, data analysis, and myself, and even the steering committee professors, all of us will be equal in the final in the final manuscript. This is a GNOS publication, and they found that median time to from injury to surgery was 13 hours. Overall mortality was 18. After adjustment for case mix, the odds of mortality were greater in the medium HDI countries with 2.84 odds ratio, but not in the low HDI relative to very high human development index countries. So in BRAVE, to run the analysis for this kind of studies, we retrieve data from the World Bank about the Human Development Index, and we divide countries to 3 parts: high-income countries, low-income countries, and middle-income countries according to the HDI, and then we run the analysis based on this. There was a significant association between hospital. There was significant between hospital variation in mortality rate between different countries. This is the result of the GNO study. Our study that's not published because the study is still ongoing and is expected to conclude this year. But this is the protocol of our study. It's published in Oxford University Press. You can have a look on the study protocol if you want. So this is the timeline of our first global neurosurgical study, and in the future we plan for more work in cerebrovascular accidents, stroke, epilepsy, and other neurosurgical conditions. In brief, this is the model. Our model is a 3-circle model of collaborators, a steering committee, expert group of professors and neurosurgeons who are expert in research methodology and also in neurosurgery. They put the idea of the study and they are responsible for manuscript writing and data analysis. Country leads, which is the 2nd circle, those are people we are in contact with and they are coordinating multiple centers in their countries. And the 3rd and the bigger circle is the data collection teams who are collecting data. Up to three collaborators every 2 weeks are collecting data in one center. So we can have many data collection teams and one country lead to be the contact point with the collaborators. And also we invite collaborators to monthly or bi-monthly meetings to discuss about the status of the study. Our authorship is based on a collaborative authorship model, which is similar to Global Surge. As you see, the paper is published using a single group name, and all people are listed as collaborators. And this is more equitable and allow more opportunities for people in low and middle income countries. I myself, I come from Egypt, and I know how it is to collaborate with people from high income countries. We need to preserve the power dynamics when collaborating with low and middle income country researchers and high income country researchers. That's why we try to provide more opportunities and involve them in the protocol writing, in the manuscript writing, analysis, and try to provide equitable authorship model. Which is important for successful collaboration. Our model is also different because we somehow relied on medical students to access some areas. In some poor resource setting, it's difficult to find a neurosurgeon and communicate with them to participate in the study. But you can find a medical student. It's easier to find medical student than to find a neurosurgeon to participate in the study. So we reverse the model by asking students to identify neurosurgeons to participate in the study. And this was a very successful model, enabling us from accessing many poor resource setting and including them in our study. And recent statistics showed that 24% of the study collaborators are neurosurgeons. At least one team member in the study should be a neurosurgeon, and 2 can be students, trainees, junior residents, or whatever, or maybe more consultant neurosurgeons. It's okay, but at least one person in the team should be a consultant neurosurgeon. How to run a global collaborative study in brief. This is our experience. First, you identify a priority area. Then you formulate an expert group as a steering committee, gain support from a host institution, which is Oregon Health and Science University in our case, to host the database, and then disseminate the study to using social media, using Twitter, using our personal communications, and even presentations in big conferences and communication with professional societies. Lessons learned from this work is large collaborative studies have the potential to give larger clinical pictures in neurosurgery. The use of social media for dissemination is very effective. You need to consider medical students and trainees as collaborators in large multi-center studies. Equitable collaboration with low and middle income country authors is very important. Recently, we have a new proposal to study stroke in the MENA region. This is a smaller study, but not the global neurosurgery 2 study, but this is a smaller study that we are currently proposing for the future, because stroke has the highest incidence rate in the MENA region, in Middle East and North African countries. So we aim to complement this work in the future by using our existing network in the MENA countries to audit the management and outcomes of stroke in the MENA region, and also to assess the current neurosurgical workforce in the MENA region. Then we aim to build a strategic framework to inform the governments in low and middle income in the MENA region in particularly, how they can distribute the existing neurosurgeons to provide the optimal patient care and to prevent more mortality from TBI and stroke. We will collect data of TBI and stroke together, complement them in our modeling using geospatial mapping techniques to inform the governments about the optimal distribution of the neurosurgical service and neurosurgeons to serve the population based on these estimators. The expected outcome of this paper to provide comprehensive clinical epidemiology and details about the management of stroke in the Middle East and North African countries, and it will improve the neurosurgical care in MENA region, and particularly when related to stroke and TBI. I have here to acknowledge my Professor Ahmed Raslan, Professor Ahmed Hikazi, who participated in formulating the study group of the Global Neurosurgery Research Collaborative. We have 2,000 collaborators from 77 countries in the world. I have to acknowledge their participation. Without them, this effort was not possible. Also, Zoe, Brittany, and Caleb, they are the research fellows in the neurosurgery department of OHSU who are coordinating the database. And I have also to thank my professor, my supervisor, Professor Kibark, for his continued support and encouragement. I would also to thank, I'd like also to thank the steering committee member, country leads, and all participating collaborators. And I think this is the website of the collaborative. You can scan the QR code or take a screenshot from this slide if you want, and you feel free to visit us and register your interest on the website or communicate with us to collaborate in the future studies. And thank you very much. Thank you.
Thank you,
Ahmed. A very nice talk, very informative for all of us. I have one question, maybe that would be also interesting for our attendees. So
Yes.
You very nicely pictured the way that you actually come up with this idea, and then how you basically realize this project. But how, if any neurosurgeon or neurosurgery resident or trainee wants to be part of this or contribute, how which pathway they should follow, how they can contribute to that project or the future projects that you have?
Okay, there is our website. I will send the link here to our website. You can register. Anyone can register. Any trainee or neurosurgeon can register, and they will be registered on the database. They will automatically receive the updates and the link for the next study. The current study, we are not currently recruiting, but we are accepting registrations for the next global neurosurgical study. So join the team. There is a page called Join the Team on the website. They have to click on this page and fill the registration form, and you will be sent all the information related to participating in the study. This is the link I just sent in the chat box here.
Okay, perfect. Thank you very much. So
Thank
are there
you.
any other questions to Ahmed in the audience? So you can still ask questions at the end of the session. So I'll proceed with the second speaker. Thank you, Ahmed, once again. So our second speaker is Bipin Chaurasia from Nepal. He'll be talking on the power of social media in neurosurgery. Some of you probably, or maybe most of you know Bipin from social media. He is a consultant neurosurgeon in Nilkantha Hospital and Research Center, Ibnc, Nepal. He is very much interested in neuro-oncology and neurotrauma. He is actually famous for creating the largest social media group of world neurosurgeons, which is called Neurosurgery Cocktail. And his Facebook group has almost 30,000 members. And it's very interactive platform for sharing ideas, cases, events among neurosurgeons worldwide. He also a very prolific researcher. He published 1,024 peer-reviewed articles in almost all of them in the very recent years using the power of social media, I guess. And he serves as editorial board member in various neurosurgical journals. And I personally met him, I think more than 5 or 6 years ago in the World Congress of Neurosurgery in Istanbul, and since then he has been very active very active in the field of neurosurgery, neurosurgical education, and research. Please welcome Bipin, and we'll be listening to his talk about the power of social media in neurosurgery. Bipin. Okay, can you unmute yourself, Bipin? We cannot hear you.
Yes.
Bipin, we cannot hear you. Can you turn on your microphone, please?
Good evening, everyone. Are you getting?
Yes, now we can hear you. Can you also make full screen, your presentation full screen?
You getting me? Good evening, everyone. Me Bipin Chaurasia from Nepal. It's now it's almost 10 o'clock here, 10 p.m. And thank you Ibnc for inviting me for this webinar. The power of social media in neurosurgery, it's well known. And the social media is underrated in medical field, especially among neurosurgeons. Many feel engaging here is a waste of time. They feel non-educational and non-worthy. In contrary to this belief, it is not only the platform for passing the time and chit-chatting with the friends, but also provides excellent media for professionals like neurosurgeons to be in touch with friends instantly, easy to get access to new research, cases discussion instantly, and conference announcements, webinar activity, etc. And this has been proven during COVID time, where in COVID times, where most of us we are locked in rooms, and we were usually dependent on the webinars and live conferences. And for neurosurgeons, actually we started neurosurgery cocktail in 2016 with the aim of connecting neurosurgeons worldwide under one roof through Facebook group. Now this group has already spread to almost all social media platforms like Twitter, Telegram, Instagram, LinkedIn, WhatsApp, Viber, Imo, and every social media group. We have a group of neurosurgeons by same name, same group, neurosurgery cocktails, and every group has the same only one primary aim. The primary aim of this group is purely educational, and this is our group logo. And neurosurgery cocktail has till now 35,000 neurosurgeons member, including all platform. In only Facebook, we have 28,000 member as a neurosurgeon. And in WhatsApp, we have 85 groups. In one group, we have 256 neurosurgeons. And the main aim is the daily exchange of knowledge, posting of new cases, announcing webinars and conference, posting new research articles to stimulate neurosurgeons, main things widely done every day in this group. And the social media has now replaced the newspapers and advertisements. We can get all types of news, including research article published daily and posted by many authors in the group. Telegram cocktail is especially very important for each and every neurosurgeons, because Telegram cocktail is playing excellent role in distributing PDF of neurosurgery books instantly. We have almost every PDF of the neurosurgery books available in Telegram. So we can instantly share whatever books you need. But the PDF books can be transferred only in the Telegram group. Cannot be transferred. All books cannot be transferred in WhatsApp group, because WhatsApp has limited size of below 100 megabyte. In Telegram, we can transfer 1 GB, 2 GB, whatsoever it is of the size of the book. We have almost every neurosurgery books PDF available, and we are transferring every day to whoever it needs. WhatsApp is playing easy role in connecting neurosurgeons worldwide, thereby making researchers to collaborate in scientific works. WhatsApp, we can easily connect each and every neurosurgeon from the every parts of the world, and we can collaborate and collaborate in scientific work, scientific research, and that makes easy to collaborate through WhatsApp group. And it is because of this collaborative work through WhatsApp group, I published 127 article during COVID time. You can imagine 127 is not a joke. And the sole credit goes to neurosurgery cocktail of WhatsApp group. And this is actually the graph showing that during pandemic time how the graphs has increases. And the publication is 127 and the reads are 10,000 almost, and citations are 244. It is all because of this collaborative effect of through social media groups and through WhatsApp group of neurosurgery cocktails. And recently we published social media based article in British Journal of Neurosurgery by largest neurosurgical social media group, obviously neurosurgery cocktail, and its impact on communication and research. And there you can have a look at the jumbo of the main famous neurosurgeons of around the world. And this article proves that uh, neurosurgery cocktail is the only largest group and only group in the world which is most famous and helping group in worldwide in among neurosurgeons. And the main top social media users, if we refer to country, India, Egypt, Brazil, and Mexico, these are the top social media users among neurosurgeons around the world. We also published social media based paper in World Neurosurgery recently with name attitudes of neurosurgeon towards social media, a institutional study. And this is a survey based this was the survey based study of social through social media, which proves that this is the largest survey till now in neurosurgery. Because we gathered 1,190 participants for this survey among 104 different countries. So the major and the result of this paper was that every neurosurgeon feel that the social media is very beneficial, and it's many, and the collaboration through social media is widely spread. And we during pandemic time we also produce one very big paper through through survey, and mainly the survey was spread on the social media, and and the survey we did with the Marco Fontanella of the neurosurgical sciences editor, and we published it in the World Neurosurgery, and you can see that it is cited by 56 papers, and 56 people they have cited, and all this because of the social media group. And one other paper we published in neurosurgery during pandemic time, that is of importance. We gathered all the information of those neurosurgeons who died during the COVID time due to SARS-CoV virus, and we gathered all the information around the world, and published a paper on. Published a paper in memoriam by name of memoir for fallen, those neurosurgeons who died during the time of COVID pandemic. And one benefit of the social media is that every social media has every journal has its page on almost every social media. Like even in the Facebook, you can see the Journal of Neurosurgery has its page. Like neurosurgery has a word neurosurgery. Every journal has its page in the neurosurgery in social media. So social media is largely spreading everywhere and influencing everywhere. The main negative aspect of the social media is that it has some copyright issue. The contents we share are not verified, and sometimes it is misguided information we get, and there is misuse of some privacy. So the conclusion is that social media is just a boon for us and for everyone, and for every neurosurgeons. Every neurosurgeon should use social media. My personal opinion and my personal view is that neurosurgery cocktail is one such group where neurosurgeon can engage daily for particular period of time to get update of world neurosurgery activity. And thank you all for patience hearing.
Thank you very much.
You.
Thank you very much for your talk. It was nice to hear your perspective on social media. Let me see if there are any questions. Okay, so just a personal question again. So how do you manage to write so many papers in just past couple of years with so many authors?
And I think that much. I think that much paper has not been published by any neurosurgeon during that time. It's really a huge work, and it's possible only possible with the collaboration with the neurosurgeon all around the world. As you know that the neurosurgery cocktail has 35,000 neurosurgeons all around the world. So every neurosurgeon is almost connected to me through Facebook, through WhatsApp, LinkedIn, Twitter, and all that social media. So each and every minute they from neurosurgeon knock me, from some knock me for books, some knock me for some information, some knock me for distributing webinar poster like that. So with this, I'm making collaboration with different neurosurgeons, and this has been possible, I think. And still, we are almost 50 papers we have submitted, and recently 10 paper has been already accepted. So it is all because of collaborative effort.
But I'm sure that it's also because of your hard work, because I don't think that it would be possible without hard work and dedication, because it's just simply is amazing, like having more than 100 papers during the COVID time and organizing everything in social media and connecting with thousands of neurosurgeons from all over the world. Congratulations, and thank you very much for creating this platform and still connecting all neurosurgeons across the world.
Dr. Emmez would like to ask a question.
Yep. Thanks for the great work. I wonder something. Did you face any safety problems about internet or the social media, or did you have any interesting or funny event that you face?
Yeah, when I started,
We cannot hear you, Vipin.
you getting?
Yes, now I can hear.
Hello.
Yes, now we can hear you.
When I started Telegram cocktail and started distributing the recently published book, the word arena and edit and theme at that time, the Greenberg was published latest edition, and I started distributing the Greenberg. Then suddenly the theme people from Germany sent me the legal notice of almost 50,000 euro of legal notice that I have violated the copyright and I have distributed the Greenberg PDF. And I then I became speechless. From that time, I sent them the message email that I'm sorry, I was unaware, I will not do the same in future. And since then I am getting careful to send PDF to each and everyone. As you can say that any book which publishes tomorrow, I have the PDF one day before. So so I can give you the PDF any book anytime, just one day before that will publish. So it's a risky thing, and I have gone through many ups and downs, but still I am serving our neurosurgery groups 24 hours.
Thank you. It's kind of modern way of Robin Hood in neurosurgery, I think.
Not like that, but I'm helping I'm helping the needy people, you can say. You did not need to buy a book from now on. I can give you any PDF from Neurosurgery Cocktail Telegram group. And especially WhatsApp group is very effective in collaboration group, because many people almost all neurosurgeons are using WhatsApp group, and some neurosurgeons are using LinkedIn especially. They don't use any other group or other social media group. So you have to make your presence in each and every social media groups, so that each and every neurosurgeon of world will be covered.
May I ask a question? Bipin, may I ask a question?
Yeah.
I'm asking about your daily schedule. How many hours do you spend time on social media, and what would you advise to young neurosurgeons? How busy is that? Social media issue.
My laptop is open 24 hours, and I am also work 24 hours, and my 3 mobiles are already open 24 hours, so that anyone knocks me, I instantly reply to them. You can try anytime, so that no one no one can say that I have not got that, I have not got your response like that. So I am available every time whenever you knocks me.
So you don't sleep?
That's my mobile and my laptops were not silent anytime.
Okay, so thank you very much, Vipin. Now we are moving to our third speaker.
Thank you.
So our third speaker is Professor Hakan Emmez. Professor Emmez will speak about International Basic Neurosurgery course, IBNC, past, present, and future. Dr. Emmez, brief bio of Dr. Emmez. He was born in Ankara in 1974. He received his medical degree and neurosurgery residency from Gazi University Medical School Neurosurgery Department in Ankara. He also got his PhD in neuroscience in 2013. He got EANS board certificate on 2014. He's working as a neurosurgeon and academic staff at Gazi University Medical School in Ankara, Turkey. And also the neurosurgery department and Gamma Knife Center there. He's mostly interested in neuro-oncology, radiosurgery, gamma knife, cyber knife, spinal surgery, and neurovascular diseases. He published more than 70 peer-reviewed articles in international journals and also co-authored 3 books on neurosurgery. Dr. Emmez was the past president of Turkish Neurosurgical Board Committee and also associate editor of Turkish Neurosurgery between 2013-2018. He was the past president of IBNC, and he is still the vice president of Turkish Neurosurgical Society. So please, Dr. Emmez.
Thank you, Şahin. Dear colleagues, I want to first thank to Professor Berker for his politeness to give me this opportunity to talk about the International Basic Neurosurgery course. He is the boss and he could make this talk also. Thanks for giving me this opportunity. I want to give you some information about IBNC, how did it start, how it's going. Actually, you know, Turkey's location is critical. It's between 3 continents. I can say that it's in the midpoint between the Asia, Africa, and Europe. And Anatolia is the one of the most important places in the world because it's the heart of several civilizations and many communities, ethnic groups, and it's the bridge between Europe and Asia, and it's not far from Africa also. So another problem is that there's a lack of scientific organization to give basic neurosurgical knowledge in many countries around Turkey, even in continents. So Turkish Neurosurgical Society want to do something, and in this field there's a Legend course, ANS courses that I also attend for 4 times, and I got the diploma. And it's very well designed courses. They have high scientific levels. It's for more than 25 years it's going on. It's great networking opportunity, which I also really get benefit from that. The main problem is the course fee, which is not affordable for many young colleagues. And it was a really very good and established model for IBNC. Turkish Neurosurgical Society has more than 1,300 members. We are organizing more than 30 scientific meetings every year, national and international. Till now, we have hosted for many international meetings. And we are also doing basic neurosurgical Turkish course for Turkish residents for many, many years. And high number, high quality, and various neurosurgical procedures are performed in our countries. And we have many well-educated and experienced neurosurgeons. We have our journal. We are publishing lots of books in Turkish. And we are, I can say that, strong community in this region. And what's IBNC? IBNC is non-profit scientific organization of Turkish Neurosurgical Society. We provide full or half scholarship, including registration accommodation for all attendees. We give basic neurosurgical, evidence-based, and contemporary knowledge. And we are trying to make a friendly atmosphere for attendees to feel comfortable to ask and discuss. We are trying to increase the motivation of young neurosurgeons to learn and do more. And we are getting personal opinion only from experienced lecturers. And I can say that it's unique global neurosurgical educational worldwide activity because it's free. The rationale for IBNC was neurosurgery is the biggest challenge of our life. We need mentors lighting our way. We can walk further together with our family, friends, and mentors. And all young colleagues are not lucky to have distinguished mentors. And internet does not provide structured learning program. And we should support the future of neurosurgery and global neurosurgery. And maybe the most important thing is that if a surgeon saves thousands of lives, a teaching surgeon can save much more. So in 2012, Turkish Neurosurgical Society started IBNC. İhsan Solaroğlu was the first president, and he established with the organization team this course. And then in 2015, Professor Tanju Uçar became the president. And 2018, I was the president of IBNC. And after that, I proudly say that Mustafa Berker is the president, and he's doing much more work on IBNC. So we performed 8 courses face-to-face. Actually, the first one was on neurotrauma. It's the structure is that there are 4 courses in one term. One is neurotrauma and functional. The second is oncology. The third is spine and peripheral. Now, third course is always the neurovascular. We repeated for 2 times, but for the when we were planning to make the 9th course, the pandemic conditions started. So we had partners, strong partners. One was the Congress of Neurological Surgeons in 2016. For 4 years, WFNS supports us. Maybe in the future we can make collaboration with the ANS or also WNS. Our academic organization is actually formed by 3 parts. One is invited lecturers. They are generally the legend experienced surgeons and also the honor lecturers. And academic organization committee is young colleague, involves young colleagues who make the main operations. Now, till now, our honorary international lecturers, you can see them. We started with Yaşar Gil, then Sami Dempsey, all legend names supported IBNC and came to Antalya. What do we teach? We give basic information. We are trying to teach how to diagnose, how to manage, what to do or not to do. Also, we are trying to teach how to do it, and we are trying to teach modern technologies also. The academic organization committee is the core of this course, and they are under 50 years of age. They are coming from teaching hospitals. They serve as lecturers and moderators. If any lecturer in a faculty is not present, something happens, they substitute it. We are also checking the scientific quality of all presentations and questions before the meeting. And they stay in the hall during whole course. And they also they moderate the discussion sessions. There are 3 meetings before the main course. The first was the education of faculty. They are learning how to moderate discussions and the learning objectives. So we teach our teachers actually. The second is the formation of academic program, and the third is the last check. This is 1 day before the course. We are checking all the presentations, all the questions to make a high standard course. So in one hall, all the attendees are in the same hall. We are also taking some signatures to check their continuity and presence. We certificate after each course, and we give diploma after 4 courses. And lectures can be downloaded after the course. It was actually the first format was interesting. There was also electronic voting before the sessions, before the lectures, and we were evaluating the audience position, how they get benefit from the lectures. We also make the electronic voting after the sessions. For the last time, we changed the format. We make discussion group round tables. All the attendees were listening to the sessions in this round tables with 1 lecturer, and after each lecture, they are discussing on the sessions and the questions. Now we are for 2 years or for 1 year, we are making online courses, and this course is one of them. We make case presentations. We show the case, ask the questions, and the answers are hidden in the lectures. So in real time, they learn many things, and they learn the answer of the questions. Actually, it's a kind of international school of neurosurgery. Our friend, Dr. Ignatius, was one of our attendees, and he gave a great student lecture at that time. Now he's supporting us, and we are really honored and happy to be with him and know him. We also put some how I do it sessions. We are putting some videos including basing approaches from the experienced surgeons. And we are trying to make also workshops. And attendees, actually majority are the residents, 25% are Turkish attendees, trying to accept attendees from various countries. Women have priority, residents over 2 years have the priority, and attendees from undeveloped countries have priority. You can see our president, Emel Avcı, in 2012, nearly 10 years ago. So for the accommodation, we are trying to provide high quality hotels. They stay 2 attendants in each room, free airport hotel shuttle, free social programs. And for the last, I want to show IBNC some pictures and give some knowledge about IBNC 2009. We performed with WFNS. Giuseppe Lanzino was the honorary lecturer. He really support too much that course. We have famous international invited lecturers. We made 21 how I do it session. There were 41 lecture, 11 discussion sessions, and there were 1 workshop. So between 2012 and 2015, from 73 countries, we gave 320 scholarships. In IBNC 2019, we have total 130 attendees. They are coming from 42 countries, as you see their flags. We have 34 Turkish attendees, so we have 164 attendees actually. And we have full scholarship for nearly more than 100 colleagues and half scholarship for nearly 20. So here are the countries and the numbers that the attendees are coming from. North Africa, East Asia, South Africa, Central Asia, even North America. So we are mostly sponsored by the Turkish Neurosurgical Society. Every year, Professor Gazi Yaşargil gives some support to us, and medical and non-medical companies are also our sponsors. And 2020 pandemic conditions started, so we decided to make it on online. So again, in a structural fashion, 1 is neurotrauma, the 2nd was functional, 3rd was decision-making on spinal trauma, the 4th one, how I do it session about basic microneurosurgical approaches. And also there are again some important names from worldwide supported us. And it was my last webinar. We had more than 400 attendees worldwide, and really experienced surgeons supported this course. So July 2021, Professor Mustafa Berker became the president, and he started his webinar series with pediatric neurosurgery with really legend names worldwide. And then for 8, 9, and 10, he make endoscopic skull surgery courses, which he's really expert on it. And in these courses, there are more than 100 and 500 attendees in 10 webinars, and maybe half were the international attendees. So our future perspective we are planning and hoping to make face-to-face courses again with the support and partnership of pioneers and global societies. Maybe we can make 2 courses per year. We want to increase our friends, our colleagues who attend these courses. We want to have much more international lectures, and like Ignatius, we want to have much more IBNC graduates having good career like him. So we are trying to touch by teaching, and I want to thank to all our Turkish neurosurgical past presidents, to also the IBNC presidents and all attendees, all organization committee members to make this dream, I can say dream real. And thank you for listening to me.
Thank you very much, Professor Mens, for this excellent talk. You brought us back to those days. I'm also one of the IBNC graduates, which I'm very proud of. And thank you very much for keeping the IBNC spirit alive for 3 years. And now the thanks to Professor Berker for doing the same. And I hope that we will continue our IBNC series in person format very soon with the guidance and help of all our senior neurosurgeons, professors, teachers, and colleagues. Are there any questions in the audience to Professor MS? Professor Berker, do you have any words?
Thank you very much, Dr. MS. I hope we will continue the face-to-face IBNC educational series. Also, I would thank to all contributors and speakers and teachers. I hope we will do it next year. Thank you.
Thank you, Professor Berker. Are there any questions in the audience? If not, now we'll move on to our fourth speaker, who is also, I think, one of the first graduates of IBNC. And now I'll present him, Dr. Ignatius Esena, who is now the current chair of World Federation of Neurosurgical Surgeons, Young Neurosurgeons Forum. He works as a faculty in the University of Bamenda, Cameroon. He is very active in neurosurgical education and research. He had his neurosurgery training in Ain Shams University, Egypt. He had several fellowships in both small base and cerebrovascular surgery at UW-Madison and Wisconsin. He had a couple of postgraduate certificates in global health from University of Leeds, University of Brussels. And as I mentioned, he was the student of very first class of IBNC in Turkey. He knows probably IBNC and history better than any other international person. So he's also serving as an international advisory board member of IBNC. He serves as advisory or editorial board member of a number of neurosurgical journals, including Acta Neurosurgica, Journal of Neurological Sciences, Global Neurosurgery, Egyptian Journal of Neurosurgery, Pan-African Medical Journal, so on and so forth. So he is the chair of Young African Neurosurgeons Forum and also WFNS Young Neurosurgeons Forum. So please welcome Dr. Esena. He is going to talk about the Young Neurosurgeons Forum of WFNS, its activities and projects and future perspectives. Please, Dr. Esena.
Are you able to see my slide?
Yes.
Well, thank you so much for giving me the opportunity to speak this evening. It's a great honor and pleasure for me to be with the family of the IBNC. You know, IBNC was started in 2011, and I'm privileged to be one of the attendees that was given this opportunity to study in Antalya in Turkey. Well, there's no conflict of interest. All the material presented here are those our works, and this is my team. These are the members of the WFNS Young Neurosurgeons Forum, representative of all the continents on Earth. As Professor Emez presented, you can see the past, present, and privileged to have met all of them during the IBNC, from Professor Hissan, Tujar Oka with Akal Feridon, Professor Emez, who is like a mentor to me now, and then we have Professor Mustafa, who is the current chair. And I was privileged after our first meeting with the IBNC to write in the Turkish bulletin what I thought about the International Basic Neurosurgery course. And as we said, it came at a very crucial moment where young neurosurgeons across the world were looking for training opportunities. So, and to find a course which was very affordable with scholarship given to young neurosurgeons and trainees from LMICs was really a very big opportunity and a privilege. So we thank the Turkish Neurosurgical Society, the Turkish government, and again, all the Turkish neurosurgeons and the IBNC family for providing such opportunities to young neurosurgeons. Well, you can see during the IBNC, I was privileged to meet most of the Turkish neurosurgeons. Professor Yasajil, we are fortunate to meet him for the first time in our lives. You see all the Turkish neurosurgeons here. So the WFNS Young Neurosurgeons Forum is is one of the committees of the World Federation of Neurosurgical Society, and it was created by Professor Majid Semi, who is one of my sponsors. So it includes residents and trainees and fellows who are within 10 years after completing their residency and training. And the aim of this group is to represent and promote the interests of young neurosurgeons at the national, regional, continental, and the global level. And we do this by building capacity, knowledge, and skills of the young neurosurgeons, developing their training and educational capabilities, and helping them to be good researchers. We do this through online courses, physical courses, webinars, and so on and so forth. The WFNS Young Neurosurgeon Forum is organized like a turbocharged organization. Here we have the WFNS, which is here with the chair, and there's a co-chair and a secretary, and then we have representatives from all the continents. We work in collaboration with other committees in WFNS because we are more or less like an advocacy committee. So we have to work with the technical committees like the neuro-oncology, the neurotrauma, and functional neurosurgery, so that the young neurosurgeons are able to have access to these committees. So what are the activities and the projects of the WFNS Young Neurosurgeon Forum? Well, our big picture, our main goal is to develop what we call the next generation of academic neurosurgeons. That is to say, so many years back, neurosurgery was practiced in a very traditional way, but things have changed today. Like my colleague was talking about the social media. An academic neurosurgeon is somebody who does not spend all his time just treating patients, but has to be involved in education and training and research, and also be involved in global neurosurgery, which is the order of the day. But when you look at the picture in the world, it's a bit different in low-income countries and high-income countries. Because of the limited number of neurosurgeons in low-income countries, most of them spend their time treating patients. For example, I was posted to the northern part of Cameroon as a single neurosurgeon, attending to up to 10 million population. So it makes it very difficult for me to be able to involve in education and training and research. But we always encourage young neurosurgeons that despite the conditions or irrespective of where you find yourself, you need to be able to shift yourself to the picture on the left, where you are involved in these three major activities. So our major goal is to be able to encourage young neurosurgeons in LMICs to be able to practice neurosurgery the way it is done in middle-income countries and high-income countries. So to be able to understand the activities and the projects of young neurosurgeons, we had to follow an evidence-based medicine approach. So we did a survey, which was one of a global survey, to understand the needs and the barriers and the challenges of young neurosurgeons. Because we believe that to be able to design good neurosurgical policies, we need to apply the principles of evidence-based medicine. For us to be able to give our patients optimal care, we need to be able to apply the principles of evidence-based medicine. So we did these surveys and we published the papers identifying seeing the demographic, the barriers and the challenges of young neurosurgeons. We're now doing some subgroup analysis to see the challenges in the different respective continents. And what we realized that young neurosurgeons in LMICs face a lot of challenges with regards to the building blocks of health in neurosurgical system. For example, young neurosurgeons in low-income countries, about 70% of them reported that there's a limited workforce. As I cited my example, when I returned to Cameroon, I was posted to the northern part of Cameroon as the only neurosurgeon for 10 million population. It makes it very difficult for you to practice because neurosurgery requires a team approach. It's difficult for an individual to be able to succeed alone. You need somebody to be an assistant. You need neuroanesthesists. You need pathologists. You need people who understand neurosurgery, brain anatomy to be able to support you have good results. So there are limited infrastructures. For example, in most countries, they don't have access to MRIs. Most of neurosurgeons in LMICs use just a CT scan. And you cannot offer good brain surgery or brain tumor surgery with the CT scan. You need to be able to use much more refined tools like the MRI to be able to delineate the anatomy and have a good planning before the surgery. Most young neurosurgeons, especially in LMICs, don't have access to specialized centers. They practice neurosurgery in general hospitals where you have everything mixed up together without even maybe a neurosurgical department. It makes it difficult for the young neurosurgeon to be able to practice because you're working with nurses who are not even trained in neurosurgery, and they find it very difficult to understand some of the things we require from neurosurgery because neurosurgery requires meticulous follow-up of the patients. In most of our settings, there's no insurance. Patients have to pay from their pocket, and we know neurosurgical operations are very expensive. So it's therefore difficult for the patients to pay for their surgery. We therefore need to encourage governments in LMICs to be able to provide insurance for this. For example, in Cameroon, just less than 20% of my patients have insurance. So it's sometimes very difficult for them to pay for their surgery. to be able to do research, you need to be able to have data. In most developing settings, there are no electronic databases. So it makes it very difficult for young neurosurgeons to be able to do that. Thanks to the social media, at least we can use the social media now to do maybe some surveys, but there are some studies which you cannot do with the social media. Clinical research requires us to collect data from the hospital. So we need to have some of this data, some of this electronic filing system to be able to assist young neurosurgeons in this developing setting. So we are asking for countries that are a bit advanced, like the Turkish Neurosurgical Society, to support young neurosurgeons coming from these regions, not only in terms of education, but in terms of research too. So when in our survey, we realized that neurosurgeons face 3 major problems. They lack access to fellowships. After their training in LMICs, they find it very difficult to travel to high-income countries for fellowships. They lack access to educational facilities. And one of the things that also identified was lack of access to research tools. And research was the greatest problem of young neurosurgeons. Most of them are not trained in research. They're just trained in clinical neurosurgery, which is not enough, as I said before. And academic neurosurgeons need not only to treat patients, but need to be able to involve in education and training, which is what we took in our Hippocratic Oath, and also need to involve in research. So they need to be trained in research. And this problem was very much more of greater magnitude in the low-income countries than in the high-income countries. And you can see from this graph, which shows the research output from across the world, you can see that North America and Europe alone contribute to 75% of research output. I mean, Africa contributes to 0.3%, Middle East 3%. The whole of Asia, which is a very big population, China 1.something billion, India 1.something billion, Turkey 100 billion and something. See, they contribute just to 19%. So we see it becomes very difficult for us to be able to develop guidelines when all the data is coming from 2 continents. For example, we know most of traumatic brain injury comes from low-income countries, but most of the evidence comes from high-income countries. So in developing guidelines like the Brain Trauma Foundation guidelines, it makes it very difficult to apply these guidelines in low-income countries, because no matter how valid a study is locally, to be able to generalize the results, you need to be able to have data from across the world. So this is a very major problem. So we therefore journals need to encourage papers coming from low-income countries. The Turkish Journal of Neurosurgery need to accept papers coming from Africa, from Southeast Asia, from Latin America. You don't only have to focus on novelty, because this poses a problem when you have to develop guidelines. Otherwise, you only have guidelines that has data from North America and Europe. And we proved this in the paper with KIPAC, where we saw that in most of the papers, even done with international collaboration, most of the first and last authors are always from the high-income countries. So we need to be able to mitigate this aspect. That's why we collaborate with the WFNS Global Neurosurgery Committee. And one of the key targets is to promote research. Okay, we encourage journals to be able to include accept papers from low-income countries, to be able to have special section for doing more with less, like is what we see in the world neurosurgery. And we try to make them understand that the practice of neurosurgery in low-income countries is not the same like in high-income country. You're not going to be comparing Turkey with maybe a poor country in Sub-Saharan Africa or in Southeast Asia with Latin America. It's totally different. So when the reviewers see papers from these areas, they should focus on the content. If the content is good, we can always modify the form of the paper. We shouldn't just reject the paper because the paper is not saying something new. So we have to encourage young neurosurgeons and neurosurgeons from low-income countries. So to solve this problem, we develop research courses across Africa, and we're trying to extend it out to other low-income countries to promote, to build capacity in research among young neurosurgeons. This is a course which we organized in Kinshasa, and we invite editors-in-chief of major journals to come in and assist us. This is one of the courses we organized in Africa. This is Professor Benzel from the World Neurosurgery, where we discussed we discussed about research methodology. And recently, there was a special issue in World Neurosurgery focused on research methods. So things are gradually changing, and we continue to encourage high-income countries to support low-income countries. We realized that, for example, in Africa, there's no African Journal of Neurosurgery. There's an Asian Journal of Neurosurgery which publishes maybe every quarterly. In Latin America, there's a journal which is not very regular. So we started looking for ways to promote, because when you build capacity, people need to have a medium where they can publish their papers. So therefore, with Ahmed, who just presented, we called special issues in some journals, but we realized that this is not sustainable. A special issue just comes once. We needed to build a journal which is going to serve the interests of researchers in low and middle income countries. That's why we developed the Journal of Global Neurosurgery with Professor KIPAC in Harvard and Andreas Rubiano in Colombia. So this journal is not having any paywall. You don't have to pay any article processing charge. And we provide technical support to researchers from low-income countries in such a way that at the end of the day, we're going to have data across the world to be able to build much more representative guidelines to improve on patient care. We encourage intercontinental collaboration, like what we're seeing today with IBNC, having speakers from all across the world. We encourage collaboration between Asia, Africa, and Europe, North America, and other continents, because through this, we are going to be able to elevate the level of neurosurgery in the world. This is a paper which a newsletter we published in 2011, which we strongly encourage a symbiotic approach between young neurosurgeons. Young neurosurgeons across the world should be able to collaborate. Africans should be able to do multi-center studies with countries in Asia and Latin America. But to do that, we need to all of us need to practice neurosurgery in a standard way. We need to apply the principles of evidence-based medicine so that everybody's applying the standard of care to the patient. Young neurosurgeons also identify that they have access to cadaveric courses. It becomes very difficult. During IBSC, sometimes we had simulating courses, but this is not enough. That's why we encourage one of our colleagues, a young neurosurgeon from Italy, Federico, who developed a simulating model to help young neurosurgeons have access, because to be a good neurosurgeon, you need to have a good background in neuroanatomy. There's no way you can practice good neurosurgery without having a strong background in neuroanatomy. And also encourage IBNC, because I know people have the tools. Maybe during the next IBNC course, you should invite Federico, and we try to maybe have hands-on courses to encourage, to be able to give young neurosurgeons a good background in neuroanatomy. Young neurosurgeons also identify that they don't have access or maybe lack sponsorship to attend international courses. We've encouraging the WFNS to provide scholarship to young neurosurgeons. IBNC has been doing this, but it is limited, and with the economic crisis across the world, it becomes very difficult for a single country alone to do this. So we encourage maybe WFNS, maybe through IBNC, to offer scholarships so that young neurosurgeons can attend the IBNC physically and get first-hand information from masters. So to conclude, aside the traditional way of practicing neurosurgery, which is based on just staying in the operating room, we think that neurosurgery has evolved, and a young neurosurgeon who wants to grow should not only be involved in the operating the patients, he should be involved in education and training, and also conducting research and play a role in advocacy, that is global neurosurgery. The challenges of young neurosurgeons are numerous. Workforce is a very major problem in low-income countries. There's lack of resources to research and education. But we keep on saying that to mitigate and narrow this gap, we encourage neurosurgeons practice in high-income countries, in middle-income countries like Turkey, to support young neurosurgeons from low-income countries. Thank you so much for listening to us. We believe that the future of neurosurgery is in the hands of young neurosurgeons, so the world has to mobilize and invest in these young neurosurgeons and trainees. Thank you so much for your kind attention.
Thank you very much, Ignatius. Very inspiring talk. Let me see if there are any questions to you. So yeah, there is one question actually. What will be the major of the disparity between global burden of TBI being in low middle income countries while the incidence being in high income countries?
Sorry, I didn't get the question. Can you?
Can you read the question by yourself and then the chat?
Okay, the chat. Okay, let me see. Okay. What would be the measure of the disparity between global burden of TBI being in low-income countries and high-income countries? Well, yeah, you know, one of the major causes of a TBI is, you know, a road traffic accident. If you come to my city, you have the bikes. Everybody's riding without a helmet. So when they fall from these bikes, they come to the hospital with traumatic brain injuries. And also they don't have well-developed national trauma programs. So that's why you see the mortality and morbidity related to traumatic brain injury is very high. Then one of the problems I also highlighted, even in countries where they're able to treat these patients, data from this country is not published because most of the major journals don't accept these papers. They say there's nothing new. I mean, if I have to say the outcome of extradural hematoma in Garowa, in my regional hospital, and I send it to Turkish Neurosurgical Journal, I mean, there's nothing new about it. I mean, thousands of papers have been published, but this is why we're trying to insist by saying you shouldn't just publish a paper based on novelty, coming up with a new idea. We need data from across the world, across all the regions, to be able to produce guidelines that are applicable to all the regions of the world. So sometimes when the content is good, even if the form is not, we can support researchers from low-income countries to be able to have data so that we develop much more representative guidelines.
Yeah, I agree with you. The points that you raised are very critical in forming future guidelines which would be more realistic, more applicable to actually local needs, which are usually quite different from the needs and the conditions of high or very high income countries, definitely. So do you have one more question? I'm a medical student from Mauricio Guerrero, medical student from Paraguay. Are there ways for a medical student to get involved in global neurosurgery and the WFNS from the get-go? Does the WFNS have plans to involve students in the future, considering that the students are future residents and ultimately future neurosurgeons?
Yeah, exactly. There is a plan for that, and we're actually doing it at the moment. The Global Neurosurgery Committee and the WFNS Young Neurosurgeon Forum involve a lot of medical students in the activities. You know, like in most of our research activities, medical students play a very vital role. One of my subcommittee is made of medical students who are interested in neurosurgical research. So we help them in collecting data, teach them how to write research papers and supervise them so they can build a good background before getting to neurosurgical residency. So there's actually a place for the medical students, the WFNS Young Neurosurgeon Forum and the Global Neurosurgery Committee.
Okay, thank you. So, and as a chair of Turkish Neurosurgical Society's Young Neurosurgeons Committee, I have a question to you, Ignacio. So,
yeah.
I think the work that you have done so far is tremendous, like really awesome. And I also know that it's very difficult to integrate like all countries, all neurosurgeons across the world. There are certain barriers and there are certain obstacles. But do you have any specific plans to involve as many countries as possible into your activities or like longitudinal projects? Because, for example, in Turkey, we have very well established Turkish neurosurgeons.
Yeah.
Established training and research in Turkey. We also have a very active group of young neurosurgeons in the country. And then almost half of our neurosurgeons are actually young neurosurgeons. Our definition is young neurosurgeon is under 40 years of age. So, but by this definition, this is almost half of neurosurgeons are actually young neurosurgeons in Turkey. So we are trying to represent these neurosurgeons and foster their future education and research to support them as much as possible. But regarding international collaboration and partnership, I think we have to go a long way because it's not very easy to integrate and to get involved in international projects. What are your specific plans? Because I know that you've become chair very recently, so maybe you may talk about this briefly.
Yeah. So the first thing we did was to bring in the continental chairs to a group. So we've had all the continental chairs together. The next step is to bring in country representative, country and regional representative. You know, this is going to take a long time. It's not something which can do in 1 minute. So we already created a group and we're going to invite representatives from each of the countries where they have young neurosurgeons committees. We're going to bring them together so that they're going to be able to facilitate our activities at the ground level, because we don't want a top-bottom approach. We want a bottom-top approach in our activities. So it is already in pipeline. We already succeeded at the first level to bring all the continental and the regional groups together. The next step now is to bring in the national teams together. Then from there, at least we should be able to unite all the young neurosurgeons in a single group. I think maybe Piping Sharisia, I mean, with his experience with his expertise in social media, he might assist us in bringing up these groups together so that at the end of the day, there's a forum where young neurosurgeons can speak. Because even at the day of WFNS, WFNS, there's less representation of young neurosurgeons. You know, mostly the seniors are there. So we need the representation of young neurosurgeons who are there to present and preserve the interests of the young neurosurgeons.
It's like maybe kind of a database, so we use this multiplier effect as much as possible in your future. So we are also open to any collaboration and any projects that we can do together.
Yani biraz daha mikrofona yanaşır mısın? Ses çok iyi gelmiyor.
Okay, so we as the Turkish Neurosurgical Society's Young Neurosurgeons Committee, we are also open to international collaboration and partnership with WFNS, ENS, and through any social media channels that we discussed today. So thank you very much again. And our last speaker, Marisa, sent us a message that she had to go to an emergency surgery just maybe in an hour ago. I think she hasn't finished it yet. So unfortunately, we won't be able to host her today. Maybe we can have her in the upcoming meetings. I think think by saying this, that's it for today. Speakers, and I would like to give the last words to Professor Berker.
Okay. Again, we are thankful to Ahmet Negita, Bipin Croatia, Hakan Emmez, Ignatius Esene for their academic support and contribution to International Basic Neurosurgical course and Global Neurosurgical Education. Also, I would like to special thanks to Dr. Hakan Emmez for he's the best friend for me for his great academic, social, and financial contribution and great effort to Ibnc. And also another special thanks to Dr. Şahin Hanalioğlu, the excellent organization and moderation of this webinar. Thank you all of. Good evening. Good night.
Thank you, all speakers. Thank you all.